Hear me okay?
Yes.
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 Okay. So I'm going to do just a little bit of a recap for last week. We lost the lecture for last week. The VCR did not record. There was some issue with the recording. So I want to take 15 minutes just to go over how to code for ICD-10. So if you would all bear with me, I would appreciate it. So Chapter 2 was an overview of ICD-10. And then Chapter 3 and Chapter 4. Chapter 3 was outpatient guidelines, which I told you was Section 4 in your ICD-10 book, correct? So if you were to refer to your ICD-10 book, the guidelines for Section 4 start on page 41 in your ICD-10 book. Those are your guidelines for outpatient coding and reporting. Now, Chapter 3 in ICD-10 in the book, step-by-step book, happens to be the same as Chapter 9 in your book, step-by-step book. Chapter 3 is all about ICD-10, and Chapter 9 is all about ICD-9. The difference between the two is that in Chapter 9, we have V codes.
If she can see us.
In ICD-10, Chapter 3, they are Z codes. So for Chapter 3, so we only have to know this if we're watching. If you're watching if you're watching the recording, yes. Because the online people were totally confused last week, and I can understand why. So I just want to do a quick recap so they have a little bit of an idea where to find.
Doreen, something has happened to the screen.
Hi. Can you see Gardner?
I cannot see anybody.
Gardner?
I can't see anybody.
Anybody?
I'm only one in here, and I see three of you there.
Oh. So for Chapter 3 is ICD-10, and we are talking about Z codes. The Z codes replace your V codes.
Thanks.
That is the difference between ICD-9 and ICD-10. So Chapter 3, ICD-10, your Z codes replace your V codes. Now, using ICD-10 is Chapter 4. In Chapter 4, that is the same as Chapter 8. Chapter 8 would be ICD-9 codes. Well, we don't care. What we want to know, the difference between these two chapters, is that Chapter 4, we want to be aware of laterality. So again, this is just a refresher for the online students so they understand the lecture when they listen to last session. Chapter 4 is the same as chapter 8. Okay, great, thank you.
Doreen, we have one more in Gardner.
Hi,
Okay,
Doreen.
thank you. Hello,
And
Anita.
Hi.
So in chapter 4, be aware of your laterality. What does laterality mean? Right and left.
They're doing
Okay.
fine. She's just reviewing last week.
Now, let's go over how to look up or use your gem files. I'm going to ask that everyone else mutes their end, please.
Oh. You want to put your best one? Oops. Just to mute it.
Okay. So in your textbook for using ICD-10, if you look at, give me a moment. People were wanting to know how to use the gem files. The gem files are referencing chapter 2 in your step-by-step book. Now, if you go to the theory and practical, now, again, if you're listening to last session's lecture, your page numbers are going to be different. So what I suggest that you do is you try to just listen to where we are in the textbook and try to follow along listening to the headings, the categories. All right. I will record last week separately again for everyone. And if you wish to have that lecture, send me an email and I'll be happy to send it to you. But this is just a quick refresher so that if you're still struggling through chapters 3 and 4, you have an idea where to go. And then if you're still trying to learn how to use the gem files, this is how I want you to follow it. So gem files were in chapter 2. If you look on page 32 in your step-by-step book, you'll see figure 2-2 and 2-3. Now in 2-2, the first column is your I-9, the second column is your I-10. Down below in figure 2-3, the first column is your I-10, the second column is your I-9. When we go to the end of the chapter for the practical, page 48, what we reviewed last week in class was number 11. .0, and the answer to that was D. So what happened was a lot of students didn't know where to find the gem files. So if you looked at exercise 2-2 in your textbook, on page 36, right at the beginning of exercise 2-2, it tells you exactly where to get the gem files on Evolve. Once you downloaded those gem files, they would look like the examples I just explained to you on page 32. If you look at the examples on page 32, you'll notice they don't have decimal points. So when you look at 0040 to A030, the gem files on Evolve look like this. They open up in a notepad file and they look just like this. So you would scroll down to 004.0. You would see that it maps to A03, 0. Again, no decimals. Will you be using gem files throughout the whole class? No, you will not. This is so you know how to use a gem file. So if you need to go back to chapter 2 to finish it up or go on to evolve and take your exam, then you can do so. I just wanted to give a quick refresher. This is how you find your gem files. These are how you find your codes. I will re-record last week's lecture for you. If you're still interested, send me an email and I'll be happy to send you that lecture. As far as answers, the same thing. I will be going over answers tonight for 3 and 4. If you need answers for 1 and 2, email me and I will send you those answers. Any questions from the students who are listening? You can unmute and ask your questions. Okay. Thank you very much for letting me do that. Now let's get to chapter 3 and chapter 4 answers. I know last week we did some work in the exercises so that you wouldn't have so much homework to do. Did that help everyone?
Yeah.
Excellent. So if you turn to your step-by-step book, page 74 and 75, all right, for chapter 3, page 74, number 1 is false. Number 2, 3, and 4 are true. 5 and 6 are false. 7 is true. 8, 9, and 10 are false. All right. Number 11, initial office visit for diaper rash. What is the first listed diagnosis? Rash or diaper rash. The code for that is L22. Number 12, we would have congestive heart failure, I50.9. Now, would we code the dyspnea and the lower extremity edema? Why would we not code it, Fran?
Sorry, do you hear me?
Yes.
Okay. Those symptoms are part of the congestive heart failure, so it's all one thing, so you're not going to separate those from the condition.
Correct. Absolutely. 13. Either diagnosis here can be listed as first, hypertension or the vitamin B12 deficiency. Hypertension would be I10. Vitamin B12 deficiency would be E53.8.
Can you just repeat the code for the hypertension again, please?
Yes, I10. old anterior cruciate ligament tear, M23.8X2. "15 would be syncope, R55, and diabetes mellitus, E11.9. "16 postoperative pain, G89.18, with stage 4 chronic kidney disease, N18.4. Number 17, preoperative exam, Z as in zebra, 01.811 or 0.811. Then we would have carotid stenosis single, I65.21, with emphysema, J43.9. "18, bladder cancer, C67.9. The postoperative diagnosis of bladder cancer is the reason for the hematuria and more definitive diagnosis. 19, Z77.090. 20, Z86.010. And 21, Z94.1. How did everyone do with those?
It's the 19.
I had a hard time with 16 and 17. Jeez. Just had a
Okay.
hard time finding them.
Okay.
9. Z77. 0.09.
Okay. What got you about the 16, Fran?
I think it was just trying to get the wording so that I could find where I was trying to go.
Okay.
I just, it was just getting there, but I can see how you found them now, so,
Okay.
yeah.
How about you, Dan? How'd you do?
I did okay, except for the 14 actually threw me out because of the word procedure actually confused me there.
Yep. Knee procedure to repair.
Yeah.
Yep. So, yeah. So again, what were they coming in for? Yes, it was a knee procedure, but why were they having that procedure?
Yeah.
Okay. How about you, Shauna?
Well, apparently I didn't do this one.
Okay.
And skip grade on 5.
Okay. No problem. We've had that happen many times.
I generally tend to focus in on this one more than I can.
Doreen, can you mail these to us?
Mail what?
There's about 5 that I have that I only got one part of the answer.
Okay. What are they?
Whoa. With 16, I don't have the diagnosis, although I can probably figure it out. But
G89.18.
G89.18, I have the code.
Then
I don't have-
N18.4.
Okay, and the diagnosis was what?
N18.4.
Diagnosis.
There are 2 diagnoses there.
Right, I have the codes, so I just don't have the.
Postoperative pain
Yeah.
and stage 4 chronic kidney disease.
Doreen, can I get the code for 14 one more time, please? I'm sorry.
M23.8X2.
Yep. Okay, thank you.
Yep.
8 X2. Okay, and the second code for 13, it was G something.
E is in Echo 53.8.
E53.8. Okay. All right, and 17. 17, the first code was Z what?
Z01.811.
Z01.811. And 18?
C as in Charlie 67.9.
67.9. And 19, exposure to asbestos?
Z as in zebra 77.090.
77.00.
.090.
Dot zero. Oh, wait a second. Z77.00 for asbestos?
No, .090.
0.090. And 21, the last one.
Z as in zebra 94.1.
9.1. Okay, thank you.
Yep. All right, let's move on to 4 in the textbook. We'll do the workbook afterwards. All right, we did the chapter review on page 94 in class. We did 1 and 2. Did we do 3 through 10 as well?
The page is out.
So page 94.
Yeah, we did 4, but I don't have them all.
So number 1, you should have any of the 2. You can have AHA, AHEMA, CMS, or NCHS. Number 2, 2A would be term or terms. 2B would be alphabetic. 2C, subterms.
Is this exercise 4?
This is page 94, chapter 4.
Oh, okay, sorry, I had 91. 94. Okay.
So
Okay.
2A, term or terms. 2B, alphabetic. 2C, subterms. 2D, cross-reference. E, 2 and 1. F, tabular. G, specificity. H, elements. 3 is D. 4 is true. 5, 6, 7 is false. 8, 9, 10 are true. Let's go on to the practical on page 95. 2 of the common symptoms associated with kidney stones, you could have had any of the following 2. Colicky pain, hematuria, pyuria, dysuria, oliguria, abdominal distension, nausea and vomiting, fever and chills. fever, cough, chills, chest pain, and sputum production. You could have any of those two.
Chest pain and what is the second one? Chest pain and what?
Fever, cough, chills, chest pain, and sputum production. Any of those two. All right, on to 11. On to 13. It should be prostatitis acute. And the first code is N41.0. The second one is prostatitis chronic.
0.
N41.1. A87.9. Meningitis viral, not elsewhere classified.
Doreen, the odd numbers are in the book. The
Okay.
answers to the odd numbers are in the book.
Okay?
So we only need the even numbers.
Okay? 14. 15. N10. Pyelonephritis acute. N11.9. So N10 and N11.9. 16. K81.2. Are we going to code the abdominal pain? Shauna? Why?
Because it's part of the condition.
Right. We will not code the abdominal pain because it is a symptom. 17.
I didn't get the code for 16, I'm sorry.
K81.2.
Okay. 8.1.2. All right, thank you.
But
Yep.
how come some of them you do the acute and chronic separately and some you don't? Just because?
It depends on the situation.
Okay.
Yeah, because that was kind of confusing because this one says acute and chronic.
Right.
They're both the same code.
Right. Because that's your combination code.
Ah,
You're going to have some that have a combination code and some that do not.
excellent.
Is it because they're like, it's common for it to be that way?
Yes. Yes. All right, number 17, N39.0 and B96.4.
29.0. Okay.
Number
What's this
18,
second part?
is G as in George 45.9. We're coding for the attack of the transient ischemic TIA. Number 19, M19.139 for osteoarthritis post-traumatic wrist. And then the second code is S as in Sam, 62.109
62.1.
S as in Sam. And that's for your fracture. And what does the S stand for? The S stands for sequela. 20 is I69.391.
I'm sorry, what was that?
I69.391. And 21 is B97.4.
Can you just repeat number 19 again? I'm sorry.
Don't need to
The
be
first
sorry.
code.
M19.139.
On 17 is the urinary tract infection, the first code.
Yes, and 39.0 on 17.
And the second part of, what is second?
B96.4. B as in boy.
That's not 19. 19, the second one? That's
No, 17.
17 is B. I have N and 29.0. What? I don't have the second part of 17.
17, the first code is N as in Nancy, 39.0. And then B as in boy, 96.4.
96.
All set?
Yes, thank you.
Okay. Let's move into our workbook, chapters 3 and 4.
What page are you on?
$11.
Page 11?
I'll start on 9. I'll go over the true and false again. Chapter 3, page 9 in your workbooks.
Page 9.
You want to mute your microphone, Maria? Okay, thank you. Number 1 is false. Number 2 is true. 3 and 4 are false. 5 is true. 6 is false. 7 is false. 8 is true. 9 is false. 10 is false. 11, 12, 13 are true. 14 is false. 15 is false. All right, number 16. We're coding for the left upper quadrant abdominal pain. That first code is R10.12. Then we're going to code for the end-stage renal disease, which is N18.6. And then we're coding for the dialysis status, Z99.2.
Doreen,
Yes.
with those last two codes, the dialysis and the end-stage renal disease, does it matter what order those are coded in?
Really, you want to know the dialysis status last.
Okay.
Number 17. What did you have for 17, Daniel?
Current congestive heart failure.
Yes, congestive heart failure. What'd you have for a code?
I-50.9.
I-50.9. All right, number 18. Arteriosclerotic heart disease with unstable angina. Shana, what did you have for a code?
I didn't.
All right, how about I-25.110? This is a combination code.
Do I need the 0?
You should have the 0.
I had it with the 0.
That's okay. Number 19, hypertension with end-stage renal disease, I-12.0 with N-18.6, I-12.0, and I-12.0. What you'll notice under there is that it says to use an additional code to identify the chronic kidney disease. So that's why under the I-12.0 we have the N-18.6. So 2 codes for number 19, I-12.0 and N-18.6. Number 20, Z51.11, Z as in zebra, 51.11, and C61, C for Charlie. 21 is J22. '22 is K40.90 with J06.9 and Z53.09. And you'll notice that your guidelines tell you to code the reason for the surgery first because the fever is not reported as it is a symptom of the URI.
Can you just repeat those ones again, please?
Absolutely. K40.90, J06.9, and Z53.09. '23, Z as in zebra, 20.1. 24, R07.1. 25, R94.39. And I25.10. '26
What was the first code you said?
on 25,
Yeah.
R as in Romeo, 94.39. All right, 26, M as in Mary, 20.11, J45.901. 27, S as in Sam, 00.83X as in X-ray and A as in apple. So what is the A? The A is the initial encounter because we have a contusion of the left cheek. How did it happen? We're talking about what? An external cause code? A fist fight. Y04.0XXA. And remember, external cause codes are not primary codes, right? They would not be your primary code. '28, S as in Sam, 72.301A. Then V as in Victor, 80.010A as in Apple. And Y, 93.52. Number 29, Z as in zebra, 46.81. O 09.12. O 09.12. 31, Z as in zebra, 38.30. 32, Z 43.6. Z as in zebra, 43.6. 33, S as in Sam, 40.812A. Number 34, either one could be listed first. Hypertension I10 or psoriasis L40.9. And then 35, acute bronchitis J20.9, COPD J44.0, cigarette smoker F17.210. And then if we know what the infectious organism is, that would also be reported. All right. How did everyone do with those? Okay. All right. Yes, how did everyone do?
Not very good on them.
Are these the ones that you had trouble with finding the code?
Yes.
Okay, so let's give
I
me
guess- Oh, go ahead. Sorry.
No, go
What
ahead.
confuses me is that sometimes the X and the A, and that's confusing to me.
Okay.
And it's not in the book, so I don't know where to find that.
All right. So give me one of the ones that you got wrong, so that we can do it together in class. What? Show me.
27.
Okay, 27. All right, so patient presents with a contusion to the left cheek that resulted from a fist fight, initial encounter. So first off, we know that there's an external cause code here because we have a fist fight, right?
Yes.
Then it tells us this is an initial encounter. So the first thing we're going to look up is contusion. So let's start by contusion in your alphabetic index. And actually, it's going to be in your external cause index. So our external cause index is on page 695, and you look under contusion. And when you look under contusion, let's take a look. So they don't have it in there. Lucky. Okay, so it's not under our external cause. So let's look under contusion in the regular alphabetic index. All right, on page 162 in your alphabetic index, contusion, and let's find cheek. We're not going to go to left cheek, we're going to go to cheek. And for cheek, it says S00.83. So 162, we found contusion of the cheek in our alphabetic index. Now we're going to go to S0083 in the tabular. So S00.83 brings us over to 1293 in our tabular. Okay, this is a really good example, so let's talk this one out, okay? Okay, so in the example, it tells us it's a fist fight, it tells us it's an initial encounter. We know it's a contusion of the head, or parts of the head, okay? We looked it up in the alphabetic index under contusion, we found cheek. Once we found cheek, it said to go to S00.83, right? Mm-hmm. Now, when you go to S0083, that's on page 1293 in your tabular. Another thing to pay attention to when you are looking at codes in your book. Oh, I'm sorry. You might not have that page, right?
It's 687 in our book.
All right, thank you. So 687 in your book. I apologize. My book is different. I'm still working with the old one. So 687 in your tabular, okay? 687 in your tabular says S00.8. And it says superficial injury of other parts of head. Is that correct? But S00 in itself is what? S00 in itself is superficial injury of the head. This is your category. Okay? The first three is your category. So whenever you start looking up your codes, always take a minute to go back to the very beginning of the category, to where it starts, so that you are aware of any notes that apply to this category. So you'll see up above S00, you'll see all of the notes that apply to injuries of the head. Okay? It includes, and this is where we learned last week or the week before, includes, excludes, code also, okay? So it includes injuries of, and it goes down and it lists all the injuries that it includes. Then it says code also for any associated infection. So you would want to make sure you coded for any infection that might be associated. But it excludes burns and corrosions, effects of foreign body, and so on. All right? So then we get to the category itself, S00. Now, then under S00, we have an excludes 1. And then we have a box. And in that box, this is where we have our subclassification. This is where that 7th character comes in. So we want to know, are we coding it as an initial, a subsequent, or a sequela? So your subclassification, A, D, or S. Now you're going to have these subclassification boxes throughout your book. Okay? So when you're reading through your tabular, I want you to read the notes before your category, the notes in your category, and the notes after. You need to know where to find the information. You need to know what it includes, excludes. So if we go down and we look at S00.0, we see that is superficial injury of the scalp. So now we have category, and then we have subcategory. So the category is the SOO. The subcategory is the SOO.0. When you see what did we call it before? The stop sign? The red dot was the stop sign, and then the X. We're going to now see an X and a stop sign. What those mean is that we need to code to the highest level of specificity, and we have an X as a placeholder. Is everyone following so far? Shake your head yes or no. Okay, yeah, thumbs up. I like that. That works better. Thumbs up. How about you, Maria? Following? Yes or no?
The X is a placeholder.
Yeah, X is the placeholder. How about you, Darcy?
Yep, I'm good.
Okay.
A red 7, what does that mean?
Okay. Where do you see a red 7?
It's not a stop sign, it's a red 7.
Oh goodness, a red 7. It's killing me here. Oh goodness.
Would you like my book?
Yes, can I have your book?
Here. I'll read it later or watch the video.
Okay, sorry. Sorry. I do not have this book. Sorry. Next time, speak up sooner. So in your book, you see 7 in a circle, and you see an X in a circle. What that means is that you're going to have an X as a placeholder and 7 characters. So then, when you get to S00.83, on page 687 in your ICD-10 book, you're going to see X7 and then 00.83. Okay, so in order to code that correctly,
For a couple of days, and once I get into it, it will. Now, is it just a repetition of what we did?
So when you see the X on the side, X will fit here, and then your initial, subsequent, or sequela. When you have the 7 in the circle, it means you are going to have 7 characters. The X is not going to be the last character. It's going to be in there somewhere. And usually, it will be at the end of whatever's here. So, let's say, for instance, it stopped here. Okay? To make this 7 characters, guess what? You'd have to put 2 X's.
And the A is just to show that it's left.
The A is to show that it's initial encounter.
Initial encounter. Okay.
Get it, Darcy?
Yes, I do now. Thank you.
Maria? Maria, you following?
Can you hear me now?
Yes.
Okay, well, you told me to turn it off, so I haven't been able to hear you.
When you turn it off, you should still be able to hear me.
Well, I can hear you, but you cannot hear me.
Right. You shut it off. I can't hear you.
Okay. All right. Can you hear me now?
Yes, and the reason I ask you all to mute it is because when you're turning your pages and fidgeting, it's very echoey. So, Maria, are you following what we're doing here?
I'm following. I don't see that A that you're talking about. You said XA on the end. I don't see the letter A in those numbers.
Oh, you guys, your book is so different. Okay, on page 685 in your ICD-10 book, over on the right-hand side, right underneath the S00 red box, superficial injury of the head. If you look right there, it tells you initial, subsequent, and sequela. Right here. Okay. That's where you would know your subclassification. This is where the reading before, the middle, and the end come in when you're looking at your category codes. Okay? So, if it tells you that you need to have 7 characters, but the category says S00.8, then you would add 2 X's and put an A for initial encounter. In this exercise particularly, it's the S00.83XA. We're showing that it has 7 characters. The X is simply a placeholder, and the A is telling us initial encounter.
Why do you need a placeholder? Because there
Thank you.
isn't any more code to give.
There isn't any more code to give. You're right.
That's confusing, but why does it need to be a 7-letter code then?
Level of
Is it just
specificity. Because of how they changed the coding. In ICD-9, it was five digits. We either had 3 digits or 5 digits. In ICD-10, it's either 3 or 7.
So they went to the highest common denominator.
Pretty
and
much.
They just made it so
A
that all
placeholder.
the lower ones had to be the higher ones, even if
Right.
there weren't any more numbers to plug in.
Right. So like S00.1, you can use S00.1, but not if you have a code that describes a higher level of specificity. So if we have a code that says right, left, and unspecified, we have to choose right, left, or unspecified. So this S00.83 is because we know it's a contusion of other part of the head, whereas our other choices are unspecified, abrasion, blister, external, superficial, insect bite, or other superficial. We have to give a level of specificity. If there is a 7-character code that fits, we need to use it. If there isn't one, then obviously we're going to use one that does not have 7 characters. But it looks like this book is being very specific for you and telling you if there's 7 characters, you have 7 characters. So you would indicate what the is.
That's why you have to look from your index to your tabular and everything until you start running them.
You won't. You won't. Okay. 3, 6. Okay. And then Fran, Anita, you following? It's okay? Okay. All right, let's go on to chapter 4, true and false. One is false. 2 is false. 3, false. 4, 5, true. 6, false. 7, true. 8, true. 9, 10, 11, 12, 13, 14, 15 are all false. Okay, 16, 2 common symptoms, and you could have any of these too. Chest pain, shortness of breath, nausea and or vomiting, palpitations, and lightheadedness. 17, any of these two, heartburn, acid regurgitation, belching, hoarseness in the morning, reflux, pain in chest, trouble swallowing, choking feeling, dry cough. 18, runny nose, itchy and or watery eyes, sneezing and coughing. 19, swelling, pain, discoloration, and disfiguration. 20, the residual would be acute renal failure. The cause would be viral encephalitis. 21, constrictive pericarditis. The cause, tuberculosis infection. 22, the residual hemiplegia, hemiparesis of the right dominant side, and the cause, cerebral vascular accident 4 months prior.
What was the cause in 22?
Cerebrovascular accident 4 months prior. Can you ladies see that?
No, it's too small for me. That, oh, okay. 23, okay.
Yep. I think it has. No.
Oh, wow. Oh, it's moved. No. Doreen, we cannot see it. I cannot see it.
Is it too blurry, too small?
Okay, that way. 23. Channel 190.
All the ones that I did, I got the wiring service up for one. It's really low.
M32. What was?
M32 was for lupus erythematosus systemic with endocarditis.
Oh.
Doreen, could you move?
Yeah, I remember looking that one up forever. Just over and over and over again. No, it was the last one. It was the last
So look up L93 and look up the correct code and look and see what you did.
The one that's bothering me is this one right here. And then for some reason I gave it 189.
So you'd have to look at the two codes and see why. All right, so from here on out, I'm only going to assign even numbers because you have the odd answers in the back of your book. So the odd answers will be for practice because I know how you all love to practice.
Is 32, is that M32.1?
0.11.
0.11?
Yes. Why'd you do it?
Because this one said hypotension unspecified.
83.21.
Special specified because of the threatened shock. So what I did was I put other hypotension.
But when they say threatened, it's still unspecified.
Yeah, that was something I was going to ask about. Because the threatened shock didn't make a whole lot of sense. That could mean a lot of
Anything.
different things.
Right.
That's something that I would have to talk to the doctor about.
Exactly.
What did you mean here?
Yes. You would have to query the doctor. Okay, does everyone have the answers written down? Or
No,
checked?
well done. 90.8.
That I did great.
34, G49,
All right, why don't we go ahead and take a quick break, and then we'll come back and finish up with 5.
beginning, I didn't want to disturb you, but at the beginning, one of the other teachers was helping them. They made that bigger, and I can hardly see the teacher
Oh, they did this?
from the other side of lights.
Huh. Okay.
So I don't know how you would do that.
I don't know how to do this. I don't. This is the teacher?
That's the teacher, and that's the one that should be big.
Yeah.
Instead of when those two came in, two other women came with them, and they had the remote in their hand, trying to,
And then they became bigger.
and then that became bigger.
Okay.
Like, when she writes numbers on that, it's hard to see. Speaker participant, maybe?
Let's try to.
That's better. I can see this. Yeah, I can see her better now.
Excellent.
So you want to leave it like that?
Okay.
No, she told me to turn this off because she was.
Turn this off?
She told me to turn it off. It was on. Green is off.
Green is on.
Green is on.
Yeah. But this also. Let me see.
I don't need to be that close.
You work in Brunswick?
I do. All right, is everyone back?
Yes.
Excellent. Now we're going to get started on chapter 5. So, chapter 5 is all about specific guidelines, chapter specific guidelines. So, this is where we start learning about, again, not what we're going to memorize, but where to find the information. So if you pull out your ICD-10 books, your chapter-specific guidelines start on page 20. So in your ICD-10 book, your chapter-specific guidelines start on page 20. And you'll see about midway in the page, letter C, chapter-specific guidelines. That would be a good idea to tab it. Make sure you can find it. And as I mentioned in the last class, when you see guidelines in your textbook, you should have your ICD-10 books open to the guidelines so that you're referencing where they are. And any highlights or underlines or writing you do in your textbook for notes, you want to make sure you transfer those notes to your ICD-10 book. So, we start out with chapter 1, your parasitic diseases. And this is where we start off with A00 through B99. Chapter 5, chapter-specific guidelines. So these codes, A00 through B99, what you're going to find in this particular chapter, this one chapter, chapter 1, is that there are going to be a lot of instances of multiple coding and combination coding. And these codes are divided based on the etiology or the cause. So again, these codes are classified according to the etiology, which is the cause of the disease. And then you have combination coding, which is one code that fully describes the diagnosis. And then you will have multiple coding, which are two or more that fully describe the diagnosis. And as you see on page 97 in your textbook, you have some examples there. All right, so an example of a combination coding would be candidiasis infection of the mouth. B37.0 would be a combination code. For multiple coding, where you have two or more codes, let's say we have a UTI. Well, what's the organism of that UTI? It might be E. coli. So the UTI we would code first with N39.0, and then the organism, which is the B96.2. Then we have resistant infections on page 98. So I had your I-10 book open to the guidelines because that's where we started. In your textbook, we're on page 98. So resistant infections and sepsis. This means that they are resistant to antibiotics. Multiple coding is acceptable when it takes more than one code to fully describe the condition. So let's say, for example, multi-drug resistant Mycobacterium tuberculosis, also known as MDR-TB. The exceptions to this would be methicillin resistant or methicillin susceptible. In the resistant infection category guidelines, the first listed diagnosis equals the infection. Then it would be followed by a code from the category Z16, which is infection with drug-resistant microorganism. So what do you think comes first? The disease, the disorder, or the cause? What do you think, Daniel?
I'm not sure, but wouldn't it be the cause comes first?
The disease or the disorder?
The disease or the disorder?
Yep.
I don't know.
No, it would be the disease or the disorder. One of those would come first.
Oh, okay.
It just depends on the situation. All right, on page 99, sepsis, severe sepsis, and septic shock. What is sepsis? Sepsis is or equals septicemia. If it is an unknown organism, we would report the sepsis as unspecified. What is SIRS? SIRS. SIRS is an inflammatory condition associated with the sepsis. So it's going to be very important for you to know the correct definition of the septic terms, since they are so close in nature. Septicemia is infection in the blood. Septic shock is when the infection is so bad that the circulatory system starts to shut down. Over on page 102. All right, your bead codes. Your bead codes include the viral infections. They're also illustrated in diagram 5-2 at the bottom of your page 102 in your textbook. Viral hepatitis is reported with the codes in the B15 through B19 range. And then we have human immunodeficiency over on page 103. B20 reports HIV infection and includes AIDS. If we have a positive serology or culture, but there are no symptoms, you would report Z21, which is asymptomatic HIV status. If there is HIV exposure, but there's no positive report, then we would report Z20.6, which is contact and exposure to HIV. If we have an inconclusive serology, R75, we would use this code for newborns of mothers who have AIDS. So again, if they are asymptomatic, use Z21. If they have contact and exposure to HIV, Z20.6. If it is an inclusive serology, R75. When we have someone who's going for HIV testing, we would report that encounter for the screening with Z11.4. I'm still on page 103 in your textbook, the very last paragraph. Some additional codes that would be documented for high-risk behavior would be Z72.51, high-risk heterosexual behavior, Z72.52, high-risk homosexual behavior, and Z72.53, high-risk bisexual behavior. Everyone can hear me okay, right? Great.
Yes.
Okay. All right, page 105 in your textbook. Neoplasms, chapter 2. So in your guideline book, chapter 2 is on page 25, neoplasms. Okay, neoplasms, chapter 2, codes C00 through D49. Your neoplastic conditions can affect all parts of the body. First, what we do is we locate the neoplasm in the index, and then once we properly find it in the index to code it, we need to determine the form. So if you look in your ICD-10 book, you'll find a neoplasm chart. Locate your neoplasm chart in your ICD-10 book, please. And there are extensive guidelines, as you see on page 106, 107, 108, and 109 in your textbook. If you look on page 111, you will see what I'm talking about as far as what your neoplasm table looks like. And it should be under N, I believe. Tell me what page you have it on.
1336.
Okay, so 1336 starts your neoplasm table. On page 111 in your textbook, you'll see what it looks like. So you have over on the left-hand side, you would indicate, or you would start looking for the type of neoplasm. Once you found the neoplasm in this table, you would then in turn go to your tabular to confirm you have chosen the right code. So this would be a tab. I would put a tab on this one. When we see codes C00 through C96, these are your malignant neoplasms, and these are your primary and secondary. D00 through D09 are the carcinoma in situ, or CIS. These are known as non-invasive or not invasive. Your D10 through D3A are your benign. The D37 through D48 are the uncertain, which means not clearly benign or malignant. And then D49, unspecified behavior, not stated as to behavior. So unspecified literally is we do not know. Some of the stages of the neoplasms. We have staging for renal cancer. We have 4 stages. You'll see on page 110 in your textbook, we talk about the stages. They should also be listed in your guidelines underneath chapter 2 in your ICD-10 book. So what page is that, Daniel?
I'm not exactly sure.
It's okay.
Is this it? I don't think this is it. This talks about neoplasms.
Right. So there's your neoplasms. And it comes over, talk about things like cancers, malignancies. Doesn't, does it? Okay. I thought it would talk about the stages. Okay. Sequencing of neoplasm codes. All right, so it doesn't talk about it in your guidelines, but in your textbook, it does show you the staging. And you have 4 stages. So the stages for renal cancer. Stage 1, tumor of kidney capsule only. Stage 2, tumor is invading the renal capsule and vein, but within the fascia. Stage 3 is where we have a tumor extending to regional lymph node and the vena cava. And stage 4 is where we have other organ metastasis. Your pathology report and your staging information will be documented in the medical record. Sequencing and complications, over on page 111. Sequencing and complications. The treatment will be directed at the primary site. When this happens, the sequence of the primary site first. And then the secondary site would be sequenced second. So let's just say we have chemotherapy, immunotherapy, and radiation therapy. Over on page 112, we talk about sequencing. They give you a couple good examples there of sequencing. So a patient presents for immunotherapy for a malignant primary neoplasm of the trigone of the bladder. So you're going to report what? You're going to report that they're coming in first for either chemotherapy, immunotherapy, or radiation therapy, and then you're going to code the malignant neoplasm. Then, if there's any complications, you would sequence the complication first. So what type of complication might we have? In the example they give you, dehydration. The patient is dehydrated. And then what next? The adverse effect of the antineoplastic and then the neoplasm. Go ahead.
How can there be an X before? How can there be an X before a number in this example?
Look it up. Go ahead and look up T45.1X5A. Let's look up T45.1X5A. Now tell me why.
That's just the way it's labeled.
Exactly. That's the way it is in the book. So Daniel's question was, why is there an X in the middle of the code? And it's because that's the way it is in the book. We don't necessarily have to choose where that placeholder goes. It's supposed to be already there for us, except in the instances where in the red circle we have X and 7. That's when we determine where that X goes, and it's usually going to be before the A or the D or the S. Make sense?
Unfortunately, yes.
Okay. Did you like math? Okay. So, history of neoplasm codes. The history of the neoplasm codes are only reported when the neoplasm eradicated and is no longer present with no active treatment. So a patient comes in, they've had a malignant neoplasm, they've had active treatment such as chemotherapy. Sorry, I misspoke. The patient comes in, they have a malignant neoplasm, they're treated for it, and it's eradicated. In that instance, we would use a history code, a personal history code. If they are currently in active treatment, such as chemo, then they're not going to report a history code because it has not been eradicated yet. You only use the history codes when their issue has been resolved or taken care of. All right, Chapter 3. Chapter 3, diseases of blood and blood-forming organs and certain disorders involving the immune mechanism. These are codes D50 through D89. What page in your book, Shauna? So page 29 in your ICD-10 book for your guidelines. Chapter 3.
It doesn't say anything.
What does it say?
Reserved for future guideline expansion.
There you go. So chapter 3 is reserved for future expansion in your guidelines. So in this chapter, this is where the codes for your blood disorders will be found. There are not only disorders of the blood, but also of the blood-forming organs. Your anemia is one of the most common blood diseases. These are codes D50 through D64. Under the main term of anemia, there are many subterms that relate to the type or cause of anemia. So go in your alphabetic index and look up anemia right now. What do you have? How many are under there? How many pages? How many columns?
2, 3, 4, 5, 6, 7, about 7.
Okay, so just for anemia alone, there are roughly 7 columns to choose from. Then underneath some of the other reported codes, you'll have coagulation defects and other disorders. Page 118 in your textbook. Endocrine, nutritional, and metabolic diseases, chapter 4. You okay? These are codes E00 through E90. This is where you will find diabetes codes. Your diabetes codes are E08 through E13. These are due to conditions classified elsewhere. You would use E08. If you have drug or chemical induced diabetes, it would be E09. Type 1 is using codes E10. Type 2 codes used are E11, and other specified diabetes would be codes E13. Remember that your endocrine system consists of the glands that are located throughout the body, and these are what is responsible for secreting the hormones into the bloodstream. Who can give me some examples of endocrine disorders or diseases? Shauna, what do you think? Well, diabetes is one. Goiters. Hypothyroidism. Hypothyroidism. Vitamin deficiencies. And dehydration. Diabetes mellitus, you will also find combination codes that will include the type of diabetes, the body system that is affected, and the complications. So let's say I have someone who has type 1 diabetes mellitus with diabetic retinopathy, or diabetic nephropathy. If we do not have diabetes type stated, what are we going to do? Daniel? Ask the physician. Ask the physician. When we are in doubt, we are going to ask the physician.
You didn't specify.
That's right, you didn't specify. What do you mean here? What does this scribble look like?
So these orange boxes right here are supposed to be exactly what's in here.
Yep. Yep. So if you make notes in your textbook, make them in your guidelines. Chapter 5, Mental, Behavioral, and Neurodevelopmental Disorders. Page 122 in your textbook. These are codes F01 through F99. If we have someone with alcohol dependence and use, it's going to fall into code F10. Opioids, cannabis, sedatives, cocaine, stimulants, hallucinogens, and nicotine, they fall between F11 and F19. Psychological disorders are going to fall through F20 to F29, and mood disorders F30 through F39, such as bipolar disorder. If we have anxiety, stress-related, F40 through F48. Behavior syndromes, F50 through F59, such as eating and sleep disorders. Adult personality and behavior, F60 to F69. Intellectual disabilities, F70 to F79. Developmental disorders, F80 to F89. Child or adolescent behavioral and emotional disorders, F90 through F98. And any unspecified disorder, F99. If we go into pain disorders are related to psychological factors. If that is the case, we would report G89 for the pain and F45.41 for the pain related to the psychological factor. When we talk about dementia on page 123, we have vascular dementia, dementia and diseases classified elsewhere, and unspecified dementia. Chapter 6, page 125 in your textbook. Diseases of the nervous system, chapter 6. These are your G00 through G99 codes. What you will find here is many combination codes. So for example, intracranial abscess and granuloma is a combination code. This would be G06.0. Your manifestation codes. An example for this one, neuroleptic-induced Parkinsonism. Well, the code here is G21.11, but we want to code the additional for adverse effect if it's applicable to identify a drug. So remember, chapter 6, a lot of combination codes. When we have non-psychological pain, this is localized pain. Localized pain is reported with codes throughout I-10. Ear pain, limb pain. Your ear pain is H92. Your limb pain is M79. It just will matter what body system you're talking about. Category G89 is an NEC pain, which is not elsewhere classified. So for example, we have acute pain due to trauma or chronic pain due to trauma. Acute pain, G89.11. Chronic pain, G89.21. Your R52 reports unspecified pain, that is acute, chronic, generalized, or not elsewhere specified, not otherwise specified. When we talk about dominant and non-dominant sides, we're on page 129 in your textbook. Dominant side is if you are right-handed or left-handed. Paralysis or plegia is reported based on the dominant or non-dominant side. So the codes to report any of these would come under G81. If the dominant side is not known, you would report dominant. If the dominant side is unknown, you would report right-sided. Most people are right-sided. All right, diseases of the eye, 130, page 130 in your textbook, chapter 7. Diseases of the eye, H00 through H59. This does not contain all of the eye and adnexa codes. This chapter has excludes 2, which will direct you to other categories such as injury, which is trauma, injury, which is relates to poisoning and certain other consequences of external causes, and neoplasms. If you look at page 131, you see the structure of the eye and the ocular adnexa. We have the hordeolum and the chalazion. What is the hordeolum, Daniel?
An inflammatory infection of the sebaceous glands at the base of the eyelashes.
Yes. Infection of sebaceous glands reported on the location and type of the eyelash. You have right or left, upper or lower. You have unspecified. The chalazion is infection of the eyelid that forms a mass. That would also be reported on a location. Then we have entropion and ectropion. Entropion is turning inward of the eyelid. Ectropion turning outward of the eyelid. The lacrimal system, turn to page 132. These are codes H04. 132 in your textbook. Codes reported on right, left, bilateral, or unspecified. These would be reported using the H04 codes. Then we move on to diseases of the ear and mastoid process. Chapter 8 in your guidelines, and page 132 and 133 in your textbook. You'll notice you have excludes 2 here that indicates other categories for reporting other ear conditions, such as the endocrine, nutritional, and metabolic diseases, injury and poisoning, and neoplasms. These codes also report diseases of external, middle, and inner ear, as well as mastoid, other, and surgical complications that are not elsewhere classified. On page 134 in your textbook, diseases of the circulatory system, chapter 9, I00 through I99. Your excludes 2 note throughout this chapter indicates other categories for other circulatory conditions, such as your neoplasms and your symptoms and signs and abnormal clinical and lab findings. It also will cover systemic connective tissue disorders. Keep in mind that these codes report conditions such as rheumatic fever, hypertension, ischemic heart disease, and cerebrovascular diseases. Hypertension on page 135. Hypertension falls under I-10. I-10 includes the arterial, benign, essential, malignant, primary, and systemic. The arterial, when we hear that, it is increased arterial blood pressure, which means hypertension. Systemic, arterial BP exceeds normal for several months, or exceeds the norm for several months. Primary is essential, cause unknown. And then secondary, due to underlying condition. We also have transient which is temporary, and we also have hypertension during or due to pregnancy. When we talk about hypertension with heart disease, this is I-11 codes. And these would include conditions that are reported with I-50 and I-51. Your I-11.0 is hypertension, heart disease with heart failure. Your I-11.9, hypertension, heart disease without heart failure. In your book, in your textbook, it outlines these different heart diseases for you. It also will talk about hypertension with kidney disease. So chronic kidney disease and hypertension on page 138 and 139 in your textbook. With chronic kidney disease and hypertension, you want to assume a relationship between the chronic kidney disease and the hypertension. Your I-13 codes are a combination for categories hypertensive heart, and chronic kidney disease. If there is heart disease present, you want to assign the category I-50 code. And then if you look on page 138 in your textbook, it lists the different stages of chronic kidney disease with hypertension. Myocardial infarction on the bottom of page 138. This is an acute heart attack with occlusion of the coronary artery. A STEMI is a slight elevation of a myocardial infarction. This is the most severe. This is where you have total occlusion. And a NSTEMI is a non-elevation of myocardial infarction, less severe partial occlusion. Then we have subsequent, and we have complications within 20 days of initial myocardial infarction. Over on page 141 in your textbook, Diseases of the Respiratory System, Chapter 10, J00 through J99. Some of your codes here are combination codes that identify the condition and the causative organism. So let's use, for example, acute recurrent streptococcal tonsillitis. That would be J03.01. The other codes would require separate reporting of the organism. If we had acute recurrent maxillary sinusitis, use an additional code to identify the infectious agent. All right, any questions on that chapter? Speak now or forever hold your peace. Okay, well, let's do some of the exercises. Let's turn to the review, the practical and theory and practical at the end of chapter 5. All right. Shana, I-10 on page 144. I-10 assumes a relationship between hypertension and renal failure. Think about that again. I-10 assumes.
True. Because that's the other answer.
That's right, it's true. All right. Daniel, if a patient is admitted for an HIV-related condition, the first listed diagnosis is the related condition, followed by the diagnosis code B20.
True.
No. False. 2 is false. All right. 3. Fran. A Y90 category code would not be assigned to indicate a blood alcohol level.
True.
No, it's false.
Okay, thank you.
You're welcome. Number 4, Darcy, what do you think? Another term to describe malignant hypertension is accelerated hypertension.
False.
No, that is true. All right, 5, hypertension that is caused by another condition is called essential hypertension. Maria.
True.
No, it is false. 6, status asthmaticus can be assigned if the physician documents an acute exacerbation. Daniel?
True.
False. 7, there is no I-10 to report insulin use. Anita?
There's no I-10 to report insulin use. False.
Correct.
There's nothing.
Number 8, if a patient receives insulin for diabetes, type 1 diabetes should be reported. Shana?
False.
Correct. False. All right, number 9. The site to which a malignant neoplasm has spread is the what, Fran?
The metastatic site.
Oh, sorry.
Sorry.
Yes. Yes, A. All right. The site in which a malignant neoplasm originated is the what, Anita?
It's primary site.
Yes, primary site. All right. I'm not going to do, let's see. Over on page 145, let's do number 14. Acute bronchitis with chronic obstructive bronchitis. First of all, let's talk this out. What are we going to start with first?
Bronchitis.
Bronchitis. What type of bronchitis?
Acute.
Acute.
Right. And then what?
Obstructive.
So bronchitis acute with chronic obstructive pulmonary disease. Go ahead, look it up. And don't blurt out the answer. I'll call on each one of you. All right, has everyone found it? Just yes or no?
No.
All right, so we started with bronchitis, right? And underneath bronchitis, we should find acute.
Acute or
Yeah,
subacute. That's that.
120, J20.9.
Yeah.
So bronchitis acute, and then we should find with chronic obstructive pulmonary disease. So we find that,
Yeah.
Yeah.
and where does it send us? Okay, so then go into your tabular.
Take 44.0. So, nope. With a. Acute.
It's additional code. So
All right, Darcy, what did you find?
J44.0.
All right, Fran, what did you find?
Did we get the same thing?
I think
Or was it
so.
J44?
Yeah, that.
J44.0. J44.0 is what we got.
Okay, Maria?
I can't find it. I'm in upper respiratory diseases and I don't see bronchitis.
Okay. So Maria, on page 1109 in your IC10 book, did you find the bronchitis?
I'm not that far up. I was on page 401, upper respiratory diseases. 1109, you said?
1109 in the alphabetic index, bronchitis.
1109.
All right, Shana, what did you get? And Daniel. No. We would go find the organism that's causing infection. So, right, I usually just would go to infection and find out
This is what
what
was
type
like
of
last week. It was all like no one had their thing muted. So noise. It's kind of funny.
But if we knew, we would have to use the additional. So on page 1109, Maria, did you find
Yeah,
bronchitis?
J. I'm on. Okay, I found acute or subacute. J20.9.
Okay, but it says acute.
It says it. Yes, it says acute. And
Okay.
from 1110.
Okay, so then you want to find a bronchitis acute with chronic obstructive bronchitis.
Okay, J44.0.
Okay? Does everyone concur that's what the code is?
Yep.
Yes.
That is the correct code.
Yay!
You did it. Okay. Let's go into the workbook. Chapter 5 in your workbook. Now, every week is not going to be, free homework help. Just keep that in mind. So I'm not even going to do the true and false. We're going to move right into the page 22 in your workbook. So the odd numbers are in the back of the book. Let's do 22. A patient with early onset Alzheimer's progresses to combative behavior. What's the first thing we're going to start with? What is Alzheimer's? It's a disease. So we're going to start with disease, Alzheimer's, early onset. You didn't have to. That's okay. You're ahead of the game now.
Wait,
Yeah, but I didn't do 3, so.
I think that's funny.
wait, so we actually were on 3 and 4?
Yeah.
Oh my goodness, I'm actually on time. I'm not a week behind.
There you go.
I've been panicking this entire time.
No, I usually try to review the chapter with you, and then you can go home and finish the exercises. If you do them ahead of time, it's just practice.
Yeah, there you go.
There you go. It just means you have a head start for next week.
I don't know how to do progresses to do that day.
Okay, so what it shows us here in the tabular is that up above the first code, it says use additional code to identify the dementia. So then you get to choose from one of those 3, and you go into the tabular and decide which one it is. So what would combative behavior be? That would be a behavioral disturbance.
G30.9.
Close.
Oops.
Did you get that? She said it's Z30.9 is close.
G30.9.
G30.0.
Yeah, G30.0.
But there's 2 codes to this one.
Yeah.
There's 2 codes.
So,
Oh,
can you see okay?
that behavior just needs desync.
Yes.
It's this.
And what is this called? This is
That's the
combative behavior.
Yeah, that's the
Okay,
combative behavior part of it. Whoops, F02.81.
Is it F03.91?
Yes.
Oh,
03.
I'm sorry, 81. F02.81, sorry.
Over crazy. I'm like, wait, what?
Read the complete.
What did I just?
So tell me the code, G.
G30.0. And then F02.81.
This is your answer. Your answer for 22. G30.0 and F02.81. So what we did here, once we looked into the tabular, is we looked above the G30.0 and we read the notes. The includes, the use additional, and the excludes one. Now this patient had early onset and they were progressing to combative behavior. So the Alzheimer's disease with early onset was the correct code, but if you read your notes up above, you saw it said to use additional code to identify, and then it gave you the 3 choices. So combative behavior is a type of behavioral disturbance. And Alzheimer's is a form of dementia. All right. Number 24. We've got 3 codes for this one. 24. An obstetric patient in her 3rd trimester of pregnancy is admitted for pneumocystis carinii pneumonia due to AIDS. We'll do that. We'll let you do that at home. How about 26? Let's do 26. Patient in a homosexual relationship presents for HIV screening. The patient is asymptomatic. What's the key word here?
HIV.
Screening. 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 What'd you come up with, Daniel?
It's 11.4.
Shauna? Fran?
We got Z11.4.
Maria?
I got the same thing, the 11.4. I don't see asymptomatic in this list.
That's fine. Darcy?
Z,
I got the same thing. Z 11.4.
That's what it is. Z11.4. All right, let's do number 40. Over on page 24.
Big honking chapter. Holy cow.
The patient underwent fulguration of a malignant bladder tumor. So what is a bladder tumor?
A neoplasm.
It's a neoplasm. Neoplasm of what?
Bladder.
what number was
So
that?
neoplasm.
40.
Neoplasm. Oh.
Bladder.
So here's the bladder. Malignant.
Did you say 44?
No, 40.
Oh, 40, okay. Thank you.
So we're going to look up neoplasm of the bladder, which is under urinary, malignant, primary. And urinary happens to be one of those modifiers. It's just additional information. Okay, Darcy, did you find it?
I got C67.9.
Fran and Anita?
Yeah.
Yep, that's what we
Marie-
got.
Maria?
It's 67.9 for that.
Shauna?
Say.
Daniel?
C67.9.
All right. Good work, everyone. See 67.9.
Correctly charged. So,
All right, number 42. 42. A 45-year-old man seen in the office is diagnosed with right carpal tunnel syndrome. What are we going to look up? Where do we start?
Oh no, good.
Rest.
Oh, where is it?
Syndrome.
Syndrome. I wish every time we get a right answer there'd be balloons that would come down from the ceiling.
I can ring a bell. I'll get
Yay.
a bell. I'll bring a bell. Ding, ding, ding. I could.
right behind you.
Oh, yes. How's that?
Jeez.
Okay, so what kind of syndrome? Carpal tunnel.
Carpal tunnel. Let's see. Where's syndrome? Syndrome. Right here. Okay.
Yes.
Ooh, bubbly lung syndrome. That sounds gross. That's not what we want. I don't know.
With right, so it's specified. So
Right, it is.
carpal tunnel.
Right, carpal tunnel syndrome. So,
G56.0.
but then we gotta go look.
No.
'Cause-
We have to see.
Carpal tunnel.
What do you have, Daniel?
Well, I just found the first part. I haven't checked
Right.
it.
Go ahead, check it.
G56.
G56.0.
And then right, it's right, right? Okay. What is that?
So one
This?
is the right. Yeah, G56.
Where is it? It is
Right.
one. Z
G, like girl,
56 point
0. Oh, where is it? Right there.
01.
01.
Shana, what do you have? Daniel,
Remember what the question again?
42.
Two. In that case, G56.01.
Maria?
G56.0.
Fran?
G56.01.
Darcy?
G56.01.
Where'd you get the 0?
G56.01.
It's right.
Okay. How about 46? A man arrested for disorderly conduct is brought to the emergency room. He is a known alcoholic dependent patient. Alcohol blood level indicates intoxication. Where are we going to start?
Alcohol?
Disorderly conduct. What is disorderly conduct?
External.
Alcohol. A man has a disorderly
Oh.
conduct.
Okay.
Drunkenness.
Drunkenness. Oh.
Drunkenness.
I can be disorderly without being drunk.
Okay. And then blood level indicates intoxication. He's an alcohol dependent patient. Would you say this is acute or chronic?
Chronic?
Both.
Actually, he has a high level, so right now it's acute. So drunkenness, acute in alcoholism.
Drunkenness, emergency room.
Let's see. Drunkenness. Well, I'll be darned, they do have drunkenness. Oh boy, acute in alcoholism. Okay.
F10.229.
Anything else? Okay.
All right, Fran, what'd you get?
We got F10.229.
Darcy,
I got the same.
Maria, you got the same too, right?
Yeah, she.
Shana,
No, she's.
Daniel,
Yeah.
Yay.
all right.
So avalanche means that you drowned. I was looking up at the back of the book. Apparently, avalanche equals drowning.
Could be. Yep. All right, number 50. Page 24, number 50. Delirium tremors due to withdrawal from cocaine dependence. What are we going to start with? Nope.
Withdrawal?
Nope.
No.
Dependence.
Dependence.
Oh. Okay. Dependence.
Then what? What kind of dependence? What is cocaine?
Drug.
It's a drug.
Then what kind of drug? And then we have with withdrawal.
Okay, here we go. God, it's hot here. Dependence. Oh, look, there's so much of it that I found it. We're dependent on everything. All right, so. Dependence.
And then go to drug.
Ah, right there. So, with, I don't know if it has any kind
D.
of. Oh,
D.
check that out.
Oh, D.
Dependence drug. Is there? Cocaine with delirium. Well, is that it though?
And then cocaine.
Yeah.
And then withdrawal. Cocaine, then withdrawal here somewhere.
Tremors? No. Withdrawal. Well, that's the withdrawal right there. F14.23.
Yeah, that's the one. Yep.
Okay.
Point.
Okay, Darcy, do you have it?
Like,
Oh,
yeah.
there.
F14 222.
Okay, Fran and Anita.
F14.23.
Maria?
Yeah.
I just lost it.
Because that, yeah.
I have NEC F9.20.
Shana.
I would have guessed other F14.
Daniel.
F14.23.
F14.23.
Yay! That's pretty good for being half asleep.
So if you didn't get that, look at it, compare it to the code you did get, and you'll understand why you didn't. And if you don't understand it, then let me know. But write it down beside it so you can look it up and understand why later. Let's do number 52. Mononeuropathy of right lower limb due to diabetes type 2. So what are we going to start looking up first?
Diabetes.
Diabetes. What'd you come up with, Shauna?
11.41.
Daniel? Fran and Anita?
11.41 is what I have.
Okay.
Yeah.
Yeah, that's
That's what we got.
but
E11.41.
it's not specified, right? Our
Yeah.
name.
Okay. That's okay. It doesn't have to specify the right lower limb. It's just that we have diabetes. How about Darcy?
I got the E1141 as well.
Excellent. E1141. Okay, E1141. All right, last one, number 58. Right carotid stenosis causing a cerebral infarct. So what do you think we're going to start with there?
Stenosis.
And what is a stenosis? What does it do?
It blocks the blood flow.
So it causes an occlusion. An occlusion of what?
The carotid
The artery. Which artery?
Carotid.
The carotid.
Right. Carotid
And
artery.
then with infarction.
So
So occlusion, artery, carotid with infarction.
So
Occlusion. First.
What do you have, Darcy?
I don't have anything yet.
Okay. Which way you're headed?
I was headed to disease.
Okay, keep going. Daniel, when you looked it up, how did you look it up?
I looked up, I can't remember how to pronounce it.
Occlusion?
Occlusion. And then I went to cerebral infarction.
Okay, and did it bring it, what'd you bring it to?
I-63.22.
Okay, not it.
160.
All right, Fran, how did you find it? How did you and Anita go about finding it?
we went.
Oh yeah, we went for like you
Okay, we went to occlusion, and then it from there artery, and then it said carotid. It led us right in there with infarction,
Okay.
and then from there went to the index, or the tabular, and found it.
Right.
Okay. Shana, what'd you get?
163.5.
Yep. Maria?
I have 163.23.
Darcy?
Still looking.
Okay. So if you follow this path, occlusion, artery, carotid with infarction, if you follow that path, it will bring you to It will bring you to I-63.231.
Yay.
Okay? So what did you do, Daniel, that you know why you got it incorrect?
I stopped just short of it because I said it was unspecified. Because it's right. It says it's right,
Yeah,
and I didn't go far enough.
right. So because it said right, Daniel didn't go far enough. So, Darcy, what made you go the way you went?
I guess I'm just not sure where occlusion came from.
Okay, stenosis.
Okay.
What is stenosis? If you remember from terminology, stenosis is what?
I'm just taking terminology right now along
Yeah.
with this course, so
If it started with stenosis, would we have gotten to occlusion?
Possibly.
It's a narrowing.
Yes, stenosis is a narrowing. When we have a narrowing, we have an occlusion. An occlusion is a blockage. So what was being blocked? The artery. Which artery? The carotid artery. What else was going on? We had an infarction. Understand now?
yes, thank you.
That help? Good. You've got to really try to pick these apart. Are you going to know every single one? No, you're not. Okay? But if you were to, by occlusion in your alphabetic index, write stenosis, so that you would know that what that means.
That's a good idea.
Okay?
How did you get
This
the
is
one?
where that you start making those notes. Okay.
Doreen,
Yes.
how did you get the one? I thought that one. I thought the one in front of it was a one. You said it's an I-63. I thought it was 163. That's why I gave you 163. It's supposed
No.
to be I.
I.
And how did you get the one? Because the one I have is I-63.23.
Go look it up in your
I
book.
don't see a one in there for carotid with infarction due to, and I don't see stenosis either. Okay, with infarction specified. I don't see stenosis.
If you keep looking under I-63.23, you have to go down and specify if it's unspecified, right carotid, left carotid, or unspecified. You can't just stop at I-63.23. You have to specify.
Is there anything you're going to want me to bring with me with the show?
No. Okay, was that helpful for tonight, everybody?
Yes.
All right, takeaway from class this week, Anita. What is your takeaway?
More clear.
Good. Fran, takeaway.
Yeah, definitely. It's definitely starting to make more sense. I think the more you do it, the more it comes together.
Okay.
And a lot of it's knowing which words to plug in to get where you're going. You know.
As I said, you're not going to know every single word. You're not going to know every little nuance with it. But if I can help direct you here in the practicing phase, and you make the notes in your ICD-9 or your CPT or your HCPCS, it will start to come together. Shauna, what can I answer for you? Did you get lost with that one? Okay, where did you go?
I switched page, but somehow I kept going down to the cerebral.
Okay. Okay,
Instead of stopping and going over there, I went down.
that's okay. So the other thing to keep in mind when we're doing this is to stop and continue reading. Don't just stop like Daniel did. He just stopped. Or don't continue reading too far, because we all do it. It's not, one person does it more than the other. We see a word and we think, that's it. But we have to continue reading. Or we think that, oh no, I've got to keep going, this isn't here. Take a break, move your eyes, move your head, just break the focus and go back to it, and you're going to see it differently. Does that make sense to everybody? Darcy, what's your takeaway?
I got a better understanding of the ICD-10 when you explained it a little more in depth.
Okay, good. Maria?
I just got the two books, the CPT and the IC10, so it's a little easier to find things.
Okay. And Shana? Takeaway?
Oh my God, speak.
Daniel?
Never taking the tab out of conditions. Never.
Good. Okay. All right. Follow your syllabus. I will see you all here next Thursday. Have a great week, everyone. Thank you very much.
Thank you.
Bye.
Bye.